is my day one recap and clinical pearls that I took from this today, which is the first day of the first annual LA Symposium in Reconstructive Plastic Surgery. It was held at Cedars Sinai here in Los Angeles. And I just want to give you some clinical pearls that I took from attending the conference today as a lymphedema therapist. So the first one is the message to our clients, which is if you are planning to have surgery, the two things that you really need to focus on, or two important things that you need to focus on, are smoking cessation and controlling your diabetes. And we had a panel full of surgeons, and they said the A1C has to be under 7. It should be 7, it should be 6.5. And as the massage therapist, as a lymphedema therapist, my advice would be the time that you decide you want to have the surgery is the time that you need to start focusing on. If you smoke, you need to stop smoking, and we know that takes a long time. And if you have uncontrolled diabetes, you have to get the diabetes under control. They will cancel the surgery if it's not necessary to your life. If you're still smoking, they find out you're smoking, and they won't do the surgery if you have uncontrolled diabetes. It just results in an increase in complications after the surgery. And this is something you can definitely talk to your doctor, your primary care physician about. Hey, how do I get my diabetes under control? How do I start to stop smoking? Also understand that Ozempic use changes the surgical planning for some surgeries, and the more I think about this, the more it needs to be talked about, because a lot of times I will see on Facebook groups that people get a surgery date, but if they're in town and they're local, and I've seen this with my clients that come on my table too, some of them will say, oh, I had a surgery date that was later on in the year, but the surgeon had a cancellation so I could get in, so I got in really quick. And the difficulty with that is it's not just that you have to stop eating at midnight before surgery. If you're on Ozempic, you have to stop Ozempic sometimes a week, sometimes more than a week in advance. So your surgeon needs to know if you're actively taking Ozempic, because they may not be able to get you into that, oh, it's 48 hours before, it's 24 hours before, can you come in and do this surgery last minute? And that's because the Ozempic in the system is actually holding food in your digestive system, and you could potentially aspirate it out, and then that would be a problem when you're under anesthesia. Specifically for massage therapists, this was very interesting to learn. Surgeons for the breast reconstruction surgery, there is the dermis, and then there's some adipose tissue, and then there's the subcutaneous fascia, more adipose tissue, and then where you'd place the implant and the deeper structures of the body. Sometimes the surgeons, when they're closing for breast reconstruction, they will sew up the subcutaneous fascia, and then they will sew up after that the dermis on top of it. So if you are doing your scar massage and you're like, this is really weird, it doesn't just feel like one layer of sutures for this scar, you're not crazy. It could be this closure where they're closing the subcutaneous fascia, and then they're also sewing up the skin. For my people who are potentially having surgery that are watching this, and if you're giving, if someone's asking your advice as a massage therapist, a lymphedema therapist, my advice would be, when you are having that consultation with the surgeon, ask them during your consultation, because you're paying for it or you're sitting there face to face with a surgeon, ask them about what are some interventions I could do in the upcoming months before surgery to improve my health prior to me having surgery with you, and listen to that answer. And one part of that, big parts of that, it's called ERAS, this prehabilitation concept, is some nutrition advice, some exercise advice, just getting yourself healthier, and especially if you can strengthen the area that you're going to get surgery on, that would be beneficial. So if you're getting surgery on the breast, like, why not strengthen your arms so it's easier to rehab you after the surgery, to regain that strength after you are unable to use your arms with limited range of motion limitations after the surgery. So strengthen before so you can get back to your life after surgery. And another part of that is getting that manual lymphatic drainage session before surgery, in the week before surgery. And I haven't really talked about that enough, I think. And I'm really going to thoughtfully add that to some of my future communications, because this pre-op manual lymphatic drainage session, it's not just this argument of, is there research, can it really affect the recovery of the client as far as swelling? Because manual lymphatic drainage and going in for lymphatic massage, going in for a session before surgery can do so much more in a specific patient selection, but for a specific client, it can do so much more than just potentially reduce swelling in the body. And this is that specific client. I'm thinking the client that has several lists, the client that has a lot of questions in the consultation, the client that says repeatedly, what more can I do? Wants to know everything, details about everything, background about everything, and wants to do everything they possibly can to heal from this surgery in the most efficient and effective way. And when that client comes in, when you talk to them, you know exactly who I'm talking about. And that client can actually have such a great benefit with doing manual lymphatic drainage session before the surgery, because it can reduce their nervousness. I'm also giving, soothing massage on the neck, on the shoulders, on the low back. It's going to reduce their anxiety. It's going to take that nervousness and that stress down a notch. It possibly, hopefully, improve their sleep in the nights before surgery. So they're going to be in a better mood when they are coming into the surgery. And they can also meet somebody before the surgery that's going to be helping them through the recovery. They're going to meet the therapist, and they're going to know that there's a plan. They're going to be able to ask the therapist questions. And we're going to take one more thing off their plate that could make them anxious in that first few days, in that first week after surgery, and that is, where is this place? Who is this person I'm going to see? What is this massage going to feel like? How do I get there? I've never driven there before. What does the office look like? What are the stairs? Where is the elevator? Where's the bathroom? What does the room look like? All these questions can be answered. They will know where they're going. They will know who they're talking to. They will be so much calmer going into and more confident going into that first MLD session afterwards if they've had an MLD session beforehand. We also had a really great talk by a radiation professional, and the advice was wait for fat grafting until 6 months after the radiation has ended. And the radiation professional also talked about a drug for treating fibrosis, and I talked about this in one of my Instagram posts. So that is important for massage therapists, because we might see that drug listed in the client's health history form. Also talked about lymphedema season, which I think is important to understand, is just more swelling happens in the warmer and more humid months. And this is for lymphedema and also for any type of surgery, in my opinion. And then if the immune system is challenged, swelling is going to change. I think people want to have this routine progression that their swelling's going to go down, but if their immune system is challenged, their swelling is going to change in their body. And then remember the lymph nodes. Remember that the lymph nodes individually push out fluid, lymphatic fluid, to the veins. So remember to keep on stimulating those lymph nodes, massage therapists, throughout your session. And just as a final aside, Dr. Patel told us that lymph nodes actually feel like jelly beans.